Okay, first thing we want to do here is this is going to go over movements. Movements happen in a joint. So flexion, you don't flex a muscle, you contract a muscle. So from here on, make sure you're using proper terminology. Start engraving that in your head, because when you get into upper level classes, improper terminology will be kind of incorrect on exams. What you learn from here carries into kinesiology. You'll redo an anatomy again, the intro to athletic training, and every course that subsequent to those. What we want to do first is review anatomical position. So there's 5 things we want to do. 1, 2, 3, 4, 5. What are they? First, you're standing erect. The person here, I am standing erect in this picture, standing straight up and down. Second, my legs slightly abducted, or slightly apart. The third thing is arms slightly abducted, slightly out from the side. My palms, fourthly, are facing forward, what we call supinated, and we'll go over that term a little bit more. And then the fifth thing is I'm facing forward. I'm looking forward, and my head is square on my shoulders. So looking forward, head square on my shoulders. That's anatomical position. All movements are described as if they're happening from this position. Remember that. All movements are described as if they're happening from anatomical position. What I will do is, next slide will be all the movements. Either have printed out your slide, or if you want to have that up on your computer and want on a smaller screen so you can look at them, or get your sheet out with the definitions on it. You should have already done that. So as we review them, you can get them back in your head from what you've read and what you've written. And then I'm going to demonstrate each joint. So what happens in each joint? So one part of this, I'll be standing on the table to demonstrate ankle and possibly knee. So let's go to the next slide here. First we'll look at is flexion. Flexion is decrease of a joint angle. Decrease of a joint angle. So if we're looking at elbow, anatomical position, decrease of a joint angle. So elbow flexion. Extension is increase of a joint angle. Elbow extension. Elbow flexion, decreased joint angle. Elbow extension, increased joint angle. We'll come back to dorsine plantar flexion. I'll do everything standing on the table at one time. Hyperextension. Think of wrist. So if we have wrist anatomical position, let's go from here, let's look at it here, and we go wrist flexion. Wrist flexion is this way. Wrist flexion, decrease for joint angle. Wrist extension is back to anatomical position. Hyperextension is beyond anatomical position. Most of the time in kinesiology, athletic training, and most things, extension, if you go from anatomical, extension is one direction, flexion is the other. So for wrist, this is flexion, this is extension. But if you want to get really technical about something, it is flexion, extension, hyperextension. We use the term hyperextension in the realm of sport as an injury. You go beyond anatomical limit. Others will say it is beyond anatomical position. So it's just a variation of the way of saying it, but for the purpose of this course and for other courses that you study in allied health professions such as athletic training, adult fitness, or exercise physiology, you want to go into med school, most of them will say flexion from anatomical position for the wrist, extension. Flexion of the elbow, extension of the elbow. Now, there's normal anatomical limit. You cannot go beyond that. It's full extension. If I would force it and fracture something to force it to go further, we call that a hyperextension injury. Abduction and adduction. You always generally say AB and AD for abduction, adduction, instead of abduction and adduction to avoid confusion. So abduction. If you look at my right shoulder, moving away from the midline, abduct. Take something away. Take it away from the midline. Remember the mid-sagittal line. Abduction, adduction. You adduct it back. So adduct it toward the midline, adduction, abduct away. Internal and external rotation. Some people, for internal rotation, will call it medial rotation. In external rotation, they'll call it lateral rotation. But for most of our courses, kinesiology, exercise physiology, athletic training, we use internal and external. So think of the shoulder. So if I'm standing here, and I'll rotate this way, pull my arm backwards, this way. It's external rotation of the humerus. Rotating it outward. Rotating it inward. External rotation, internal rotation. Circumduction and approximation. Circumduction is, think of a cone, think of the megaphone. So circumduction is this movement. This is a very small axis of movement. The distal segment has a very large conical movement or circular movement, kind of like a big cone on the end. So that is circumduction. You can circumduct the wrist. You can also circumduct the ankle and the hip. Approximation with fingers. Approximate the fingers. Open them up and close them. Open them and close them. That's approximation. Pronation and supination are specific to the forearm. The best way to demonstrate it is if I put my elbow at a 90-degree angle, 90 degrees elbow flexion, and I'm going to hold my hand this way so you can see it better. If I want to supinate, it's turning the palm upward. Remember, we said anatomical position, the palm is rotated forward. So turning the palm upward, think if you have soup to hold it in your hand, to supinate, your palm has to be up. Think of opening the doorknob. Supinate. So palm upward, supination, the movement takes place in the forearm. The proximal radial ulnar joint. Remember, you've got radius on thumb side, ulna on pinky side. They make a joint proximal, just distal to the elbow, and they make a joint distal. So proximal radial ulnar joint gives pronation, turning palm downward, supination, turning palm upward. Inversion and eversion we'll look at with the ankle. We'll wait till I stand up on the table to do that one. Protraction and retraction. Think of jutting something out and bringing it back. So if I want my neck, if I take my head and I protract, that's jut it out, retract, bring it back. My tongue, if I stick my tongue out, protraction, pull it back in, retraction. Protraction, retraction. Protraction, retraction. Elevation and depression. Think of shoulders. You do a shoulder shrug. Elevation, depression. Elevation, depression. Ulnar and radial deviation. Again, look at the wrist. Remember, radius is thumb side. Ulna is pinky side. To deviate, some people will call it a deduction, movement toward the midline of the body of the wrist, and abduction, movement away. But we'll want to call it, for the purpose of kinesiology, exercise physiology, and athletic training, most of the medical field will use ulnar and radial deviation. You deviate the wrist either toward the ulna, on the pinky side, ulnar deviation, or deviate it toward the thumb, toward the radius, radial deviation. So, ulnar deviation, radial deviation. Lateral flexion. Now we start combining some terms. And we could go on with this a lot. I will demonstrate a few and see if you know what they are here in a second. But lateral flexion, just think of the trunk. If I bend to one side, or I take my head and lay my ear to my shoulder, that's lateral flexion. Decrease the joint angle to the lateral side. I also got flexion and extension of the neck. So we'll come back and demonstrate each of those. Now let's do dorsal and plantar flexion. For this one, I'm going to stand on the table. Plantar flexion, think of it as pressing a gas pedal. Watch my ankles. Plantar flexion is going up on your toes. That's plantar flexion. Dorsiflexion is going up on your heels. That's dorsiflexion. So dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. Now watch my ankles again. Inversion and eversion has to do with the ankle. Inversion, turn the sole of the foot inward. That's how most people sprain their ankle. To say I rolled my ankle. So the sole of the foot goes inward for inversion. Eversion, the sole of the foot goes outward. So eversion, inversion. Inversion, sole of the foot in. eversion, sole of the foot out. Dorsiflexion, plantar flexion of my left leg. Now let's look at a few of the movements by joint. So let's look at shoulder. Shoulder can be kind of complex due to the fact that you're increasing and decreasing multiple joint angles. So shoulder flexion is this motion. Shoulder flexion. Shoulder extension. Shoulder abduction. And you can't go all the way up. Shoulder adduction. Okay, now we have shoulder external rotation, shoulder internal rotation. Start thinking of, when we say these, if I do this, what's this motion? Starting position, ending position. It's shoulder external rotation. Make sure you say of the right shoulder. Right shoulder external rotation. Start making sure you use right and left. If something is correct, don't say that's right for meaning correct. Say that's correct. Because in the medical field, you will mix things up, or mix someone else up if you say right for correct. Start saying the word correct if something is in the affirmative. So that's shoulder. You have abduction, adduction, external rotation, internal rotation, flexion, and extension of the shoulder. Let's look at the neck. You have lateral flexion to the left, lateral flexion to the right, forward flexion, and extension. But you also have rotation to the left and rotation to the right. A lot of movements with the neck. As you remember, you have the atlas and axis that give you the rotation, and we can nod your head yes and no, forward and back, forward flexion and extension, and right and left rotation. The atlas and axis gives those movements. So be sure to go back and review that anatomy because they're very, very important in those movements. Now let's go with elbow. So elbow, let's go, remember it's anatomical position. Everything is as if you're standing from here to start with. So elbow flexion, elbow extension. Let's go to forearm. It's easier to see if you put your elbow in 90 degrees of flexion so that you isolate movement to your forearm and don't use your shoulder. Supination, turning the palm upward. Pronation, turning the palm downward. Now let's go to wrist. Wrist flexion, wrist extension. Wrist ulnar deviation toward the ulnar side. Wrist radial deviation toward the radial side. Remember, I always said right and left. Finger approximation. Then you also have finger flexion of the MCP joint. As you make a complete fist, metacarpophalangeal joint, proximal interphalangeal joint, and distal interphalangeal joint. So go back and review that slide of the hand, because remember your thumb only has IP for interphalangeal and metacarpophalangeal. So if you make a fist, that is flexion of the IPs, the DIPs, and the PIPs, and the MCPs. So you're flexing several joints. Now let's move to trunk. Trunk, usually most people say forward flexion, or trunk flexion is just bending forward. Extension, arching backwards. Lateral flexion to the right, lateral flexion to the left, rotation to the right, rotation to the left. Now let's look at hip. Now stand up on the table again so you can see better. With hip, we have hip abduction, hip adduction. So going away from the midline, going back to the midline. Abduct, adduct. Hip extension, bringing the hip upward. That's hip flexion, almost said it backwards. Hip flexion, hip extension. So if you stand from the side, extension's going backwards, flexion's coming forward. You could also have rotation of the hip, rotate the hip outward, external rotation, rotate the hip inward, internal rotation. Then you can have circumduction of the hip, Remember the conical motion at the foot. Great big cone, point of attachment, very small axis. From small axis to a large circle. That's rotation. Or it's a type of rotation which we call circumduction. With circumduction, you'd say clockwise and counterclockwise. Everything is from the patient's perspective. So it's my right. If you're looking at me, it's on your left. Don't get that confused. Very easily confusing. Let's go ahead and move to knee. We get back up here. Not down too soon. With knee, basically you're going to have knee flexion, knee extension. So if your knee is straight to start with, it's in full extension. That's anatomical position. Knee flexion, knee extension. With ankles, dorsiflexion is coming up on your toes. Plantar flexion, like you're pushing the gas pedal, or going up on your toes. Sorry, dorsiflexion is going up on your heels instead of toes. And then inversion, sole of the foot moves inward. Eversion, sole of the foot moves outward. Those are your basic movements. Now what we want to do is just review a couple of things. One of your activities is to take a glass, put it on a table, and then you're going to reach out and grasp it and take a drink. So when you reach out and grasp it and go to take a drink, what movement's taking place at the fingers? I'm grasping it. What movement's taking place at the elbow? And pick it up. And then what movement's taking place at the shoulder? Because you have to lift it upward. So you grab it, take a drink. Set it back down. When you pick it up, what movements are taking place? Grabbing it, elbow, shoulder. So look at 3 different joints, what movements are taking place. Then go on to the next slide and see what happens. The next thing I want to do is if I'm standing and I sit down, what movement takes place? So I'm standing, what movement takes place at the hip? What happens? What takes place at the knees? Stand up and sit down in a chair. What movement takes place? You can practice several different things like that. And it does help at getting the movements down and thinking about the planes. Next thing we want to do, and when I mention planes, review planes of movements. Sorry, I just scooted that table over a little bit and made some noise. Remember we talked about planes. We have a transverse plane, a frontal plane, and a sagittal plane. That's the 3 we'll really talk about the most. With the sagittal plane, it divides into right and left halves, remember. When you do movements, they happen in a plane and around an axis. So happening in a plane and around an axis. When it happens around an axis, that's what's going around. Think of the windmill. So if I'm doing this, what's it happening around? Let me get my ruler here. If I hold it like this, you can see that it's happening around that axis. What plane is that axis in? Think of it that way. Movement takes place parallel to a plane, perpendicular to an axis. So if I do shoulder abduction, it is parallel to what plane? Shoulder abduction is parallel to the frontal plane, dividing the right and left halves. So if you think of this dividing into right and left halves, it takes place in that plane. If it takes place in that plane, then it's perpendicular to what axis? The sagittal axis. So abduction and adduction take place in a frontal plane around the sagittal axis. Let's do another one. Let's do elbow flexion. If you do elbow flexion, it takes place in what plane? It's parallel to what plane? That's the sagittal plane. If it's parallel to the sagittal plane, then it is perpendicular to the frontal plane. So it takes place, elbow flexion and extension takes place in a sagittal plane. It moves in a sagittal plane and around a frontal axis. One that can be a little bit confusing if you think of pronation and supination or circumduction. So you do this. Pronation, supination of the elbow, or circumduction. Circumduction, pronation, supination, and rotation, if you look at it this way, they take place parallel to, so if you look at my nose, it's going this way and this way, parallel to the transverse plane. And perpendicular to that, we call that a vertical axis. So rotation, pronation, supination, and circumduction all take place in a transverse plane around a vertical axis. Abduction and adduction. So abduction and adduction take place in a frontal plane around a sagittal axis. Some pretty good pictures in your text. A lot of the online help will be very good with this also. I should get some movie clips to help you with that. And then you can also do flexion extension. Flexion extension take place in a sagittal plane. So here's my sagittal plane, and flexion extension is going parallel to it and around a frontal axis. And I believe that is most of our, when you think of deviation, that's one. Elevation, depression can be a little confusing. Don't worry about that for this course. But deviation takes place in take an anatomical position, frontal plane, parallel to the frontal plane, around a sagittal axis. If you do it this way. Inversion, eversion takes place around a sagittal axis, and it takes place in a frontal plane. That's why it's not a little bit confusing. In kinesiology, you'll get much more in depth with this. Just wanted to introduce that term, plane of movement and axis of movement. A movement takes place parallel to the plane and perpendicular to the axis. So it makes a 90 degree, if you're looking for the axis, it's 90 degrees opposite of the plane of movement. And here's your activity you can do with the glass of water.